Meet the editors. May I call upon Dr. Albert Neesse, Editor-in-Chief, United European Gastroenterology Journal, Dr. Ashok Saluja, Editor-in-Chief, Pancreas Journal, Dr. David Whitcomb, Editor-in-Chief, Clinical and Translational Gastroenterology, Dr. Pramod Garg, sir. So may I all call upon moderator, Dr. Sridhar Sundaram, Managing Editor, Indian Journal of Gastroenterology.
So very good evening to one and all, and you know I'm kind of the moderator for an exciting panel. So I'm going to be doing a short session on Meet the Editors. So I have editors of prominent journals with me today. So when Sudipta actually called me for this talk, I thought I'd pulled out the short straw. But then he sent me this video clip of his. I don't know if it's going to play. Is it playing? Can you? I don't like you, Sridhar, which is why you will be panel moderator for these giants. So clearly, he actually said it to me. He sent a video clip saying that he doesn't like me. So clearly, he put me as the moderator for this. And clearly, AI can do wonders these days. So I have a clip of you, Sudipta. So this is kind of traction for me. So much like the Real Madrid Galacticos, I have the Galacticos today lined up with me. So I'm going to quickly go over some of the things that we do as editors. I'm still learning the ropes of being one of the editors for the Indian Journal of Gastroenterology. So I'm sure I can take a tip or two from all of you over here. So if you look at a brief history of scientific journals, you'll find, journals came into existence maybe in 1660s, but peer reviewing started sometime in 1730. And clearly, what we do today, I mean, the IMRAD format and the so-called formatting, referencing, all of that has come maybe in the last 30 or 40 years. I don't know, maybe Dr. Whitcomb can tell us, or Dr. Saluja can tell us, maybe how they started out with publishing, but clearly this is, a more recent thing that has come. And if you look at the number of journals, that are there, it's kind of exploded. Clearly, there are over, 100,000 journals that are actually publishing material, and close to 3 million articles that are published every year in different, journals that are peer reviewed. And of course, there are other journals which are publishing articles which are not peer reviewed again. So close to around 7 million articles are published every year. Now we are focusing largely on GI. So clearly, there are different set of GI papers that are published. And as editors are often regarded as the guardians for the journal. They look at what the journal is supposed to do, but I think they are not just guardians for the content of the journal. I think there is also the journal metrics that they are trying to guard. So clearly, they want to look. They always have a keen eye on the journal metrics, the impact factor, which kind of guides a lot of decisions at times. So if you look at people who are not editors, they often think of us as villains who are plotting, or sometimes we are often the innocent bystander because there are decisions that come to us and we kind of forward them. But I guess all of us are doing the role that is somewhere right in between these two. So this is how I'm going to go about this panel discussion. There are 4 things that I'm going to be talking about. First is author guidance to avoid rejection. The second is challenges with peer reviewing. Third is ethics and transparency in publishing. And of course, fourth is the editorial vision, the journal trends, and the future. Okay, so clearly the rules are, I think we have our panelists here, they are the referees, and so clearly whatever they say is always right. So coming to the first weapon, the editor's primary weapon, rejection, upfront rejection. So I'll ask Professor Neesse or Professor Saluja and Dr. Whitcomb, all of you, what to do to avoid desk rejection. What are your top reasons for rejection without actually even sending the paper out for review?
I think most of the time when I look at a manuscript, obviously for different journals there are different standards. I used to be A for gastroenterology, and there we had many more manuscripts and there were more desk rejections than not, and now I handle pancreas, right? So I think you start with the title. So the title has to be catchy. If it's a good title, you will read the next. Next is the letter. So many times the authors, just don't, in the letter they write, oh, all the authors approved this. Obviously they approved this, it's good to have it.
Right.
But they need to write a very succinct one paragraph, about 6-7 sentences, that what was lacking, what they have done, and how would it affect the field.
Right.
In one paragraph. And after that, if that's kind of convincing, then you look at abstract and introduction. If I find, at least my personal opinion, that they are not convincing, then you reject. Many times rejection is because there's no novelty, and it's just a repeat of most other studies. It's a single center, a repeat of other things, and that does not interest. But if you pass that muster, then obviously we send it to
the reviewer,
associate editors and reviewers, and then again.
Yeah, but another thing that I guess Professor Neesse or Professor Whitcomb could tell us, is there some amount of implicit bias towards negative results? Negative results in general when you're talking about publishing, because a lot of people do their studies, but eventually a lot of negative results actually do not get published. So what is your take on that, Professor Whitcomb, Professor Neesse?
Yeah, so I inherited, or was asked to take over the ACG journal, American College of Gastroenterology, clinical translational gastroenterology, which I rotated off after 5 years. It was a really tough situation. They're thinking about abandoning it. And so what I wanted to do is to make sure. You just talk about it. So a couple things. It was translational. One of the policies had been before is that the clinical study should not have any basic science or animal studies in it. I thought that was ridiculous because that really helps with the mechanism. I also wanted to make sure that it added something to the literature, to world knowledge, that advanced it. It wasn't just more of the same, more of the same, more of the same, things we've already known. I, like Ashok, look at the title. Is it clear what the paper's about? Does the abstract make sense? And does the abstract reflect what's actually in the paper and what the results are? Because many times they're way overstated or not very well written.
Right.
And so those are quickly rejected.
Right.
The other reason for rejection is that the peer review process is very laborious if it's done well, and I do not want to subject our reviewers to garbage. I want to think through that it has a possibility before asking them to use their valuable time to give a critical review.
Right. I think.
I was just kind of smiling when David said garbage, because I would not use that term. But people spending so much time and effort in sending you a manuscript and working it, maybe there's some merit in that, and there's some journal which will take it. For most of the time, in pancreas, and definitely true was gastroenterology, that we strongly discourage case report.
Right.
It's a one patient thing. So that's kind of that's how it's very easy rejection on those things.
Right. So Professor Neesse, I had another question for you. I mean, do you often get appeals after rejection? So often journals, the author will actually send out an email saying, why was my article actually rejected? I feel it's actually worthy of being considered. So a lot of people, I'm sure, are writing. What do you think about someone appealing the rejection and sending you an appeal for the rejection to reconsider?
Well, first of all, I couldn't agree with you more. Title is very crucial.
Right.
If somebody is not able to put a decent title down, and I think it's crucial to have a message in your title, not just being descriptive for the kind of what study you have done, but there has to be a message in the title.
Right.
And I, in fact, do reject papers or let's say, I look at the title, I say, well, this is a paper I'm going to reject. Then I look at the abstract, and most of the time I will reject the paper, but I can tell by the title. Regarding your question, authors appealing my decision, and basically at UEG Journal we have a two-tiered decision. I get to see all the manuscripts. If I decide desk rejection, there will be desk rejection.
Right.
But I leave this option also to the associate editors.
Right.
Because they have more experience in their specific field. And
Right.
So they can also say, well, I'm trying to save their time by only forwarding those manuscripts that I think could play a role during peer reviewing, but they have the option as well.
Right.
And they use the option. And I'm grateful they use the option because peer reviewing gets more and more difficult.
Clearly.
So you can only send out those manuscripts where you think, okay, they might be worthwhile.
Right.
But I think appealing rejection, whether it's if it's a desk rejection and then you appeal, that's almost no possibility. And if it has already been reviewed and by AE and then you decided that it's rejected, probability of success is 1 in 1,000.
Yeah. Okay. So again, coming back to Professor Whitcomb. So clearly, I think you're the editor-in-chief for CTG. So again, you get a lot of translational research. So how do you actually find a balance? Because that is often difficult. Because for people who are doing research, lab research, sending their articles to a clinical journal versus sending their article to another journal. I mean, how do you make that choice? That again becomes often difficult.
Yeah, so translational is a balance. The beauty of translation is that it tells you more than just association, it tells you mechanism.
Right.
And so it's important to be able to do that. Another thing that I've done before is that I'll get a paper from a good group that I'm familiar with, and I can see a progression in their effort to solve a big mechanism. But nobody knows what they're talking about. And I've had dialogues with them and saying, I think I understand what you're saying. If you can explain it to me, let's work on clarifying why this is important for the average reader. And
Right.
And so I've taken quite a bit of time for papers that I thought really the information was valuable, but it needed to be delivered in a more clear way, and it wasn't just an incremental approach, it was a significant advance. And so I do go out of my way to help authors that are struggling, especially if it's a good group and the person that wrote the paper was a new postdoc or someone like that that really needed some encouragement and needed a little bit more senior guidance on how
some amount of refinement, you mean to say. I mean, absolutely. So of course, translational articles may need some refinement from a senior person who's maybe more experienced, and clearly I think, like Dr. Whitcomb is saying, you may approach someone who may guide you. I think Professor Saluja already spoke about the importance of a good cover letter. I think that is possibly one of the most critical things. I think Taylor Francis actually put this up on their website. It's actually very good. It talks about what the contents of the cover letter. I don't think my slides are seen. I'm sorry. So yeah, Taylor Francis actually has this on their website, what the contents of the cover letter should be. So, I mean, maybe you can actually refer to the website because the publisher is actually telling you what is to be written, and that's actually good. So clearly a cover letter really matters to the editor. So now coming to the editor's secondary weapon, that is peer review. So clearly a lot of us, send articles and we get scathing reviews. I'm sure I've been at the receiving end for a lot of scathing reviews. So, Professor Neesse, I mean, if you can tell us, how do you identify good peer reviews? Your your journal is possibly one of the Q1 journals in gastroenterology, and clearly getting a good peer review is very, very, very difficult. And
Most difficult part of being an editor.
clearly, possibly the most difficult thing.
No, absolutely. And I have to say it becomes more and more difficult. If I just look at myself, I get around 20, 30 emails per week being asked for peer reviews.
Right.
I think the critical thing is you have to know as editor or as associate editor, you have to know your field well enough to know who is really interested
Right, right. So clearly
in this article. And that's the same with me, because if I'm interested in the topic, I will review the paper.
Right, very true.
So selection is critical, and if you just ask somebody who is not quite familiar with the topic, he will normally not accept the invitation.
Very true.
So I think it's about how well the editor knows the field and knows who is interested in which topic.
Right.
That is my experience.
I think Professor Whitcomb.
Yeah, another issue is that I also get invited to review dozens of papers, it seems. Feels like thousands, but what I do is I look through it and see if it looks interesting as a reviewer. If I want to do it, I try to turn it around as soon as possible, because there's nothing worse than not knowing if somebody you've invited to review is going to review it or not.
Right.
And the alternative is to send it out to 6 reviewers, hoping 2 of them respond. And so if you are asked to review, say no or yes, and then turn it around quickly. And that's a huge benefit to the field, in my opinion.
Yeah, but I guess one of the issues here again becomes you often send out articles to the same reviewer over and over again. So maybe one reviewer will get a large chunk of the articles because clearly that person is doing well, and I think the dictum goes, if you're working well, you'll get more work. So so that's often an issue. So clearly identifying new peer reviewers, I often feel that maybe your peer network can help you identify. Your fellows are often good peer reviewers because they will do the job well for you if you're doing that. So maybe, I mean, if you can actually send referrals for people, that would actually be great. I'm sure most of the journals have, if you reject, who else can you refer is often an option. So I think that often works well. Now, what do you, Professor Saluja, what do you think about incentivizing peer review? Because clearly, it's a thankless job. Editing and peer reviewing is kind of a thankless job. So.
Well, that's a great question, that how you incentivize. I think first of all, I try to look for somewhat younger reviewers.
Right.
Because
they will do your work. They will do your work. That's for sure.
That's right. And but incentive for them is really that they will learn that what are the good manuscripts,
right,
the ones which are accepted or not. Hopefully, it will improve their own writing. It did help to me. I was young one day, and it did help me at that time. Even now, if I review some, it does help me to learn more about that. So
yeah,
I think the incentive is learning about the
yeah, I guess Professor Neesse.
I think another point which I find really important is giving the reviewer a feedback. Sometimes
right,
even a personal feedback. And you get reviews where you can immediately tell he or she made an effort. She really looked into this paper and she
right,
made great comments. So I normally, either the associate editor or myself, just write a quick email saying, well, thank you for this excellent review. This really helps. This itself gives me, there's a lot of feedback saying, well, thank you very much for writing me this email. And this will also increase the probability that next time you ask, they will accept the
right.
And the other option that you have for very good reviewers, I invite them to write an editorial once the paper is accepted. And again, this is a sort of gratitude and will be appreciated, and especially from young people, if they are able to write an editorial on a paper that they really looked at closely, is a way to say thank you and to keep them aboard.
Great. I think that's actually good incentive.
I think something that most journals do that's very helpful is that when you put your review in and decisions made, you get the other reviewers' reviews back, and sometimes you see a couple of them that are very similar, and one of them that's just way out. And in those cases, I take a careful look at the outlier, and sometimes I reject the reviewer's rejection and will go with the other reviewer. So if there's one bad one, it's not out.
Right.
And
I think that was going to be my next question. What do you do about conflicting peer reviews? I think I answered. I was just discussing, one reviewer may say reject, the other will actually say minor revision or accept, and then you're actually confused as to what is to be done. And like you said, maybe actually go through the review and then maybe take a call. So I think as authors also, for all the authors here, I'm sure the editors do take the effort of actually reading the review before they're actually sending it out. Now, the other thing that I wanted to discuss was open peer review in a lot of journals. So a lot of journals have the system of open peer review. I think Frontiers has it. So what do you think about that, Professor Neesse, Professor Saluja? Any take on that? I mean, you actually get the name of the reviewer when the article is actually published.
I'm not a big fan of open reviews.
Right.
Because that's immediately, put a bigger bias. I mean, if you actually, we had a very common saying when we were, editing when I was A for gastroenterology and even for other journals, that we asked authors to suggest reviewers, right?
Right,
it's
right.
very common practice.
Right.
And most of us would want to suggest reviewers who are our friends, who are
Clearly.
more benevolent to us, right?
Yeah.
I mean, you're not going to ask someone that who's not your friend.
Very true.
And so it turns out, and there is statistical data, more often than not, the reviewers you have suggested, they will, reject your work rather than someone which editor picks.
So it's happened to me. So
if I had to write their names on it, it's not going to work.
Yeah. Very trtrue. Okay. So clearly for all the students here, clear peer review is about critique, and I mean, if you can show my slides, I'm sorry, I think. It's clearly not about criticism, so I mean, make sure that you do it the right way. Now, coming to ethics and transparency, I think this is again a lot of issues that we're facing these days. So I'll start with Professor Neesse. Again, AI-assisted writing in articles. I mean, how is UEG actually dealing with that? Do you have a disclaimer? What do you do, and how do you deal with it?
So basically, AI is posing a lot of new challenges for all journals, first of all. AI-assisted writing is not an issue. You basically have to mention it, that you were assisted by AI. I think the major issue is that increasingly paper mills are spilled on the market and spilled in the journals that are not only AI-assisted written, but they are completely generated by AI.
Yeah, so
basically fake data. And it is sometimes really hard to distinguish those papers from real papers.
Very true.
I think it's a good idea that one can use AI to improve your language. That you write a manuscript and then, but the bigger problem is that if AI generate your, data, your figures, and you don't even know what they are, and that's where the bigger problem is.
Right. So assistance is okay, but generation mean.
Yeah. I mean, to me, you write your abstract, and then, particularly if the English is not your native language, there's nothing wrong with that. That just we used to have it, when I started my, academic career,
Right. So
English was not my native language, so I will write it, and then someone will, improve on that.
Right.
And now, if AI can do it much faster, it's better.
So clearly, assistance is okay, but generation is not. Another issue that we often face is, data duplication. At least multiple trials, same data, and when it comes to transparency about that, I mean, Professor Whitcomb, if you can tell us, people will use the same set, the same results, and send it to 3 journals, and then how do you deal with that?
I was spoiled because the American College of Gastroenterology would run these papers through some algorithms or things to find out if it had been copied or if it was been published before and that kind of thing, and picked up a lot of really interesting thing. I found out that I often quote myself. And I was so embarrassed, but that was the best authority I could find. So I think that that is a problem, and there's electronic ways of dealing with it.
Right. Okay. 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 Another issue, I think a lot of good articles, especially in good journals, get retracted after publishing. And that is often an issue. I think if you look at data from gastroenterology journals alone, we've had over 700 retractions since 1990, and more than 76% of them have come in the last 10 years. So that's almost, 570 articles over the last 10 years. So clearly a lot of data that is actually being retracted because there is some amount of phishing and some amount of falsification that is there. So how do you deal with that? Because if someone is actually doing that, they should be wary of submitting it to your journal. So how does the journal deal with a retraction of an article? Professor Neesse, Saluja, anyone?
I mean, in my experience, I mean, obviously there are cases when there's a retraction. In general, it's not like,
So there's no punitive action from the journal is what I'm asking, because see, at the end of the day, it is data that is actually being published, right? And we presume when it's being submitted that it's the gospel truth. And at the end of the day, when it is retracted, for whatever reason it be, right? It technically means that whatever was sent was not appropriate, right? So the question remains, is there some punitive action that journals take with regards to the so-called author or the group or whatever? Or is there no punitive action from any of the journals? And otherwise, I mean, they will go ahead and submit another article and the same process will go on again. So what do you really think about that? I mean, should there be something? And if there is not, of course, if any of your journals don't do that.
I think if there's a fraudulent data, and then obviously if it's found out and it's retracted, that's just fine. But if that happens more than once or twice by a group, I would think that journal should ban that group.
Right.
That we're not going to
Right.
look at your manuscript.
I think Professor Neesse.
And what has changed is that Clariot citations now count your retracted articles on your impact factor.
Clearly.
So this will negatively impact, if you have 10 retracted articles per year, this will have a negative impact on your impact factor.
Right.
Because basically it will count with 0 citations. So we have to make sure as far as we can, and it would be great to be electronically supported, that the data that we publish is more or less solid. And obviously sometimes we do checks, and in my experience we had checks from certain groups, and if you see that an author had 3 retractions over the last 3 years, you will look at the paper very, very carefully.
Right.
But there's no such thing as a program that checks all
Clearly.
Data for duplication. But there will be a program very soon, I guess. I mean, there has to be.
Okay. Lastly, I mean, this is largely for Professor Neesse, because UEG is an open access journal, and I think there are often issues with regards to open access journals and their publishing models. At the end of the day, technically people are going to pay to get their article published in the journal. So I mean, one, of course, I don't think that at least in this case, because your Q1 journal, your highly cited journal, it impacts the editorial process. But what is your take overall? Because at the end of the day, is this model something that is at some level problematic, or do you feel it's all in good faith?
No, I mean, there are pros and cons. I think the main thing as an editor, from the editor's perspective, working for an open access journal, you have to make sure that you have full editorial freedom.
Right.
And being at UEG journal, and I wouldn't have accepted this job, I have complete freedom. I can reject as many papers as I want. If that's not the case, you have open access journals that will accept all papers.
All papers, yeah.
Or they will give you 5 days of revision time because they just want to cash in. This is not the way it should be. I think open access has certain advantages. Distribution is easier. In return, and that's what we really promote at the UEG journal, is you need to, I think, give the authors the benefit once you accept the paper, once you publish the paper, once they pay for it.
Right.
To promote the paper.
I think more and more journals are more publishers, actually more publishers are bringing more and more open access journals.
Clearly, because I mean...
And the only reason for that, from published perspective, I know UEG will do that, and there's some merit in doing that. Maybe I'm being more negative, but by and large, publishers' interest in that is to make money.
Clearly, so it's...
Publishing is a very profitable business.
Yeah, clearly so.
Yeah, so those are predatory journals. They're no editorial oversight. It's run by business people that...
$2,000 and you get in.
So I have not been very happy with the direction things are going, and a lot of AI and groups I'm not familiar with.
Right.
So I started my own journal, and it is an open access journal, and the authors are all invited. It's peer reviewed. The reviewers know the author that was done, but it's structured in a very specific way to meet a need. The journal is Systems Modeling and Advanced Report Technology for Medical Decisions. The acronym is SMART-MD, SMART-MD, Journal of Precision Medicine. And the last couple talks we just heard about genetics, the clinicians don't know what in the world to do when they get a weird genotype.
Very true, very true.
And so what we're doing is we are having experts write what they do under certain circumstances, and allows a hard link, not AI, but a hard link with a certain type of report, so that when you get a report, or if you have something that you found that you don't know what to do with, you can see what an expert would do in treating it. So that's what we're doing. And the two papers we published, one of them was on PRSS1 mutations. There's 5 different effects.
Right.
And you have to know which one it is. There was also an excellent paper that was just published by Claude Ferrec's group, not in our paper, but it was on SPINK1. And what they argued is that the method of having either a pathogenic or a benign dichotomy is totally inadequate. And you need additional classifications, because genes like SPINK1, they don't cause pancreatitis, but if you have trypsin activation, it has a local problem becoming systemic because you can't control it.
Right.
And so it's, a lot of this modeling has to be involved so that you can understand what these mutations do that have a profound effect on a gene that doesn't cause the disease, but if you don't have it, you get it because it's not prevented. So trying to develop a new model where it's really facilitates clinical practice and using technology to help make sure that high quality information is immediately available to anybody in the world in real time on their smartphone.
Right. So just the last slide, what comes, if you can just put it up, what comes next in pancreas research? So again, if you can actually take all of these questions at once, Professor Neesse, Professor Saluja, and Professor Whitcomb. So what new areas do you think are exciting? What about interdisciplinary work in pancreatology and impact of social media? And of course, what about publishing non-PubMed journals? Clearly, there are people who want to publish. I'm sure not everyone is able to make the cut. So what about that? What about that research? So, if you can take it.
Okay, then I'm going to start. I'm going to speak about impact on social media on publishing. And that's what I was about to say. I think, being an open access journal, UEG journal, I think we as editors should really pay back to the authors in terms of promoting, helping the authors create visual abstracts, and we do this by a professional graphic designer that UEG pays for. So that's a free service.
That's a free service.
It's a free service. So they submit a template, and we do a professional graphic abstract. That's basically a return. And I think journals, in order to survive on the market, journals need to be active on social media, and most of the articles are now distributed and looked at either via Google or social media.
Very true. Twitter is like a big hub.
A journal that is not active on social media is not going to survive.
Very true.
That's I'm sure.
Very true. Saluja, any new topics?
I think there will be new topics. I think, obviously, I'm a basic scientist, so the mechanism-based research is important and it will continue. But I think more important is like, let's say I give you example in pancreatic cancer, right? That's one of the areas, So for pancreatic cancer, there are only 2 drugs right now approved. Valflorinax or, Gemcitabine.
Yeah.
Everyone gets it. In US, there are 60,000 patients. Whether you get surgery or not, either way, you will get that.
Very true.
But we still don't know that, let's say, Gemcitabine, the outcome of those. So we need to have, is the outcome, that is the decrease in tumor burden after one cycle is more in one set of population versus other population.
Right.
We give the same drug to everyone who walks in. 50% get Gemcitabine, so all 50%, whether you're a man, woman, obese, non-obese, Asian, Caucasian.
Right.
So I think that's where, we need a lot of work in that. And
so pancreatic cancer maybe, especially treatment for pancreatic cancer.
Right. So I think that's the research which will make a bigger impact.
Right.
Eventually.
Right. What about, Professor Whitcomb, publishing in non-PubMed journals, the impact factor. We are all looking at the impact factor. We're all wanting to publish in the higher impact journal. But clearly not everyone's going to make the cut. So, what about publishing otherwise?
So I think PubMed is very important. I'm learning after starting a journal, you have to publish for 2 years, and you have to show that you have high quality papers and authors, and it meets standards. So to get into PubMed is a good endorsement. So I think that is valuable. And so my new journal, we're working on getting that. The social media is very important. Otherwise, they're invisible. It's just too much out there. So I agree with that. The area which early career pancreatologists should be looking at to work in, we need translation. You'll have experience in one science or one area that you can be able to talk to other scientists in the area. But what we need is to learn how to apply new mechanistic knowledge to help patients. And that's really what we need to do. We've got a huge amount of science going on, and the physicians don't know really how that helps them in daily practice. And the scientists are working, and they don't know if what they're doing will ever result in helping anybody. It's the physician who has training in a science and reads in their area and becomes an expert and meets scientists or other physician scientists to help really clarify exactly what you're seeing in your patients, that your knowledge of this discipline can help guide other physicians. That's what we need. It's the translation. It's the application.
Right. Okay. So I think I'm at the end of my panel. And any questions from the audience? If you have any, maybe a couple. Anything? Okay. Yeah, thank you.